Hello and welcome once again to Crush Your Mountain Wellness. I am so happy to have you with us. I am Henry Gaskins, your host, and I am thrilled to have with me an amazing young man who is doing wonders for me personally, but also he is helping so many people in the city of Oaks, helping them to maintain their flexibility, to rebuild strength and connective tissue and muscles and their joints. And we're going to talk with this gentleman about why it's so important to build and maintain your flexibility when you get 50 years old and more so. In fact, I'm going to tell you right now, the old adage is, if you don't use it, you lose it. We're going to find out why. But we're also going to find out, again, what exercises, simple things that we can do to keep from being sedentary at the desk, if that's what we do all day. Obesity is a problem in this country, quite frankly. And part of the problem is that we sit too much and too long, and we don't do enough to take care of ourselves. So let's bring him on. Let's talk to Kevin Stapleton. Welcome to Crush Your Mountain Wellness.
Thank you very much for having me here, Henry. It's a pleasure to be here.
Well, listen, my man, I thank you for taking such a bit of time out of your schedule, because you're a busy guy. So tell us a little bit about yourself. First of all, you sound like a Yankee like me, but you're not like me. So tell us a little bit about where you're from.
Yeah, so originally grew up in a small town outside of Pittsburgh, Pennsylvania, Indiana, Pennsylvania. It's Christmas time, so it's actually Jimmy Stewart's hometown from It's a Wonderful Life. So grew up there, went to physical therapy school out in Ohio, University of Findlay, then came back to Indiana, Pennsylvania, practiced for about 2 years in the field of orthopedics, outpatient physical therapy. Really enjoyed my time there. Got to spend a good bit of time with a variety of patient populations, demographics, from various joint replacement surgeries to athletes, to just your general neck, back pain. So wide range of diagnoses, which I really enjoyed. Definitely never saw the same patient twice. So really enjoyed my time there. And then just within the past year, family and I made the move to Raleigh, North Carolina here. Started working at Pivot Physical Therapy, which is where I had the pleasure of meeting Henry here. And also am currently in the process, actually just opened my own physical therapy and sports performance practice with two of my younger brothers. It's called 4-Quarter Performance. Basically, you kind of specialize in the treatment of athletes and just active adults looking to maintain a healthy lifestyle, and also provide personal training services, as well as my youngest brother who I'm in business with, played Division I football. So he also does some NFL, National Football League draft preparation as well. Kind of have a wide background. Like I've said, I've seen a wide range of diagnoses, different patient types, and I'm happy to have the opportunity here to talk with you guys a little bit about joint health and how we can maintain that as we get into those older golden years, if you will. So again, thanks to Henry for having me on here.
Well, listen, thank you for being with us. I'm going to tell you something. Years and years and years ago, I learned that keeping the muscle around the joints is just as important as building muscle on the overall. But especially after you become 50 years old, you're starting moving to 60, could you help our people to understand what changes do people experience as they become older with their flexibility, things that they could possibly stave off or even prevent? But what happens?
Yeah, absolutely. So start out with a little bit of statistics. I like that. I feel like that kind of sets the stage or the background, so to speak. So just to give you some percentages, we lose about 30%. And we're going to talk about the shoulder joint to start here. I just think that's an easy joint. It's the most mobile synovial joint in the body. So I think that really kind of speaks volumes, and you can extrapolate that out to some of the other joints as well. But we lose about 30% of our joint mobility in the shoulder throughout our lifetime. And again, you can kind of extrapolate this out to other joints as well. A lot of this has to do so as we age, we start to lose water content. We start to get some fatty infiltrate and some other kind of unhealthier substances in our tissues that aren't quite as extensible or as elastic as the healthy tissue that we have or possess when we're younger. But the good news is that a lot of this can be kind of diminished through an active lifestyle. One of the most common diagnoses we think of with older age is osteoarthritis, and some of the risk factors for that, kind of segueing into that. Previous injury is a big one. Some repetitive kneeling, squatting you see with vocational demands. The other big one, it's actually the number one most modifiable risk factor is BMI, so body mass index. We see for every pound of weight we put on, it's an additional 5 pounds of stress to our knee joints. So kind of shifting gears to the lower extremity. So yeah, the more mass we possess, unhealthy mass, so fat mass in particular, the more stress we're going to put on our joints. And with time, the wear and tear can be again kind of magnified as we get older. Kind of also, in addition to losing mobility, which we kind of touched on with age, we also tend to lose strength, power, endurance, general muscle mass, bone mineral density, and overall function. But as I mentioned, a lot of this can be mitigated through exercise. So a lot of those deleterious effects we see with aging can be greatly delayed through, again, maintaining an active lifestyle, exercising frequently throughout the week, and keeping your body in as fit a state as you can for as long as possible.
I was curious about this. How does sarcopenia affect flexibility?
Right. Yeah, so yeah, that's another one of the unfortunate things as we age, sarcopenia, or shrinking of the muscle cells. And again, this another deleterious effect of aging. But yeah, as those muscles shrink, there's an associated stiffness with them. Again, we lose those elastic properties of some of the connective tissue. Most abundant connective tissue in the body is collagen. That's the kind of the tissue we think about when we think of, you're watching commercials and you're thinking about different skincare products, but that's also again, the most abundant tissue in our tendons, ligaments, that sort of thing as well. And as we age, again, the muscle cells shrink. We also lose some of that elasticity in those collagen fibers, making us less mobile, losing range of motion. And again, a lot of times that makes us less active, and we kind of see a vicious cycle with that. So again, and we can kind of really prevent or delay a lot of this through exercise and stretching.
One of the things that I've noticed with individuals is that we have this lack of mobility, first of all. Then we have the putting on of the pounds, and sometimes they're taking medications that actually add to the obesity, and that causes them to not realize also now that you have this additional problem of rapid or prolonged or sustained muscle loss.
Right.
Yeah, the challenge with that often is these days people are going in the reverse. They're taking medications or having surgeries that causes them to lose weight rapidly. You see, now what are the effects of still sedentary lifestyle, lack of mobility, lack of exercise on their joints when they lose that weight rapidly like that?
Right. So we'll start by answering that through. So I think a lot of times you get asked, what's a healthy kind of weight loss regimen when we're talking weight loss? So In general, and again, it varies person to person, individually, but 1 to 2 pounds a week is generally a healthy sort of goal to lose weight. We start losing weight more rapidly than that, again, as Henry alluded to. That can certainly affect energy levels. A lot of our hormones are related to our fat. So some level of fat is needed. And again, when you lose that quickly, that can impact a lot of hormonal regulation as well. So 1 to 2 pounds is kind of the sweet spot. Again, it can vary from individual to individual, but that's generally a good recommendation to start with. But yeah, as I mentioned, when you start losing weight rapidly, whether it is through medication or some other means, um, again, usually you're going to have decreases in energy. A lot of times with that rapid weight loss, you're not only losing fat, but muscle tissue as well. And that can obviously pose a lot of issues as well. So like anything, a gradual progression is usually the best way to go about it. Whether you're looking to improve flexibility, as we're talking about here, strength, losing weight, generally that gradual progression is usually the best, safest way to go about it.
Simple things like taking water is so vital. A lot of my clients, one of the things they measure is their water intake. So from a flexibility standpoint, you alluded to it earlier. Could you expound a little bit on how that affects the body? Why is it so important that we really monitor, and we're not talking about liquids like diabetes water, meaning Coke or whatever else they have out there, but we're talking about water itself, whether it's enhanced water, but primarily just good old fashioned H2O that comes from the ground that can reinvigorate you. Tell us a little bit about that.
Yeah, absolutely. So again, we'll start general recommendations. We want to look to get a roughly half of our body weight in ounces per day. That's generally a good recommendation. So yeah, obviously water has numerous benefits. It makes up 60 to 70% of our body. So it's vitally important for numerous reasons. In terms of strictly joint health, a lot of times, one of the side effects of dehydration is actually muscle aches, just low energy level, that sort of thing. So with dehydration, a lot of times we'll actually lose lubrication in our joints, and that can play into, again, kind of the stiffness, loss of mobility, flexibility as well. So water is another kind of thing we can throw on to that active lifestyle that, again, is vitally important for maintaining not only just, our health in general, but specifically when we're talking about our joint health. Vitally important, again, to maintain that lubrication. As we know, with conditions like osteoarthritis, a lot of times as cartilage wears away or degenerates, we lose some of that lubrication of the joint surfaces, and water can directly play a role in that. So vitally, vitally important.
Many times I've run into so many people that think that they could just maybe do just coffee or do just juice, or nowadays they have all these energy drinks. You see, but now they have some seriously harmful effects, even if they have all sorts of quote unquote supplemental minerals in them or things like that. Could you talk a little bit about that? What have you seen in your practice with individuals who are kind of strictly on those colored liquid drinks, beverages?
Right, right. Yeah, so I think when we're talking about any really active individuals, but athletes in general, yeah, you'll see a lot of, sports drinks such as even Gatorade, which a lot of people will actually term sugar water. So it does have obviously some benefits, but yeah, the high sugar content obviously can be problematic when we're talking about conditions that you see more commonly in older age that can be a result of excessive high sugar intake like diabetes mellitus. But yeah, when we get into more of those energy drinks, a lot of times, especially substances like caffeine can actually cause dehydration, just because they inhibit certain hormones like ADH, antidiuretic hormone. So with excessive consumption of that, a lot of times, with time, when you're not, especially when you're not adequately hydrating with water or H2O, you can actually become dehydrated. And if you're doing a physical activity, that can compound that and really become problematic. So I think education, again, like Henry kind of said, is of the utmost importance with that, because when we're talking hydration, it's not some of those other drinks or beverages that we see a lot of times marketed or highlighted. It is, just strictly water with that, to avoid, again, some of those negative outcomes we see with some of those other choices.
Well, a lot of times people, maybe they drink or water or not, but something in their body, something in their joints, in their movements might tip them off that might be the problem. What might a person look for in terms of how they feel inside their bodies, in terms of their flexibility, their movement, their proprioception? What might indicate that they have a problem there? It's just, and it might be their dehydration or just lack of water intake.
Right. So a lot of the kind of common signs and symptoms we'll see. Achiness is one, particularly joint achiness. Headaches is another one. That's a lot of times not the topic of this discussion, but headaches a lot of times can just be triggered by dehydration. So that's another common one. Lightheadedness, or kind of that woozy sort of feeling, can be another one. Again, decreased urine output. Also see a lot of times it gets, a lot of hype in locker rooms and whatnot, but the color of urine as well. So a lot of times we're looking for that clear urine, maybe a faint yellow tint. We don't want to see that real dark yellow urine. That can be a sign of dehydration as well. Those are some of the most common ones I think we see, and something to look out for, because a lot of times I always stress to my athletes or even active adults, a lot of times when you are dehydrated, it's too late. We want to really emphasize pre-hydration. So prior to doing anything that's physically active, hydrating before that is really, really beneficial, because once you feel thirsty, usually it's too late. I mean, you want to start hydrating as quickly as you can, but if we can hydrate prior to a lot of those signs and symptoms we talked about, that can kind of prevent some of those signs and symptoms, and ultimately, kind of stay in that more prepared state before you go into your set activity.
Yeah, a lot of the times, just working with individuals, even myself, I'll tell you, because now I'm well past 50. And the thing is that I've noticed that if I'm not drinking enough water, when I'm moving, so you get that creaky joint syndrome,
Right.
And, you hear sometimes a person gets something, you hear that pop, and they go, oh, I'm getting old. Yeah, maybe not. Yeah, you're getting old, but maybe you're not really hydrating yourself the way you should. And
Absolutely.
maybe that's where we need to step it up. So sometimes one of the first things I try to advise my clients, I practice it myself. First thing I do in the morning is grab myself some water. I have to go through my first few exercises, and I drink another bottle of water. The idea is to have enough to keep yourself hydrated, keep yourself flushed, but also not to flush out your electrolytes. You need to also have those coming into your system. But another thing, though, that they mentioned, though, if we're eating the proper foods, we are also adding to our hydration. Leafy green vegetables, big thing. Fruits that are in season, to have that when we're in moderation because of the sugar content. We want to be wise in terms of how we take that in. If we're taking in, say, the good quality apples, this is the season for it. Pomegranates, where you have urolithin A as a wonderful component that actually helps the mitochondria. Those things also hydrate the body as well. So you don't always have to chug a gallon of water unless you're just going to be, bashing it out at the gym, so to speak. you know. But for guys like us, and I say us because you're athletic, you're obviously athletic. I would say that I'm in the post athletic state, you know, only because I don't run track anymore. But you know, for guys like us, you know, we have a certain regimen. What about your average person who maybe they have a desk job, or maybe they are kind of used to the you know, this is the South, so let's just say the local Southern cuisine. You know, if it's fried, it's good. You know that. So what do we what okay, are there exercises, maybe three simple ones that someone can do to kind of mitigate and offset the challenges of a sedentary lifestyle that can actually reduce one's life by half an hour per day?
Yeah, absolutely. So I think we'll touch on. I'm going to give three flexibility exercises that I really think kind of break up that traditional kind of desk job we see with a lot of prolonged sitting. So that flex posture typically tends to shorten everything on the front side of the body. So kind of working from top down, the pectoralis muscles tend to get really tight. A lot of times that'll pull us into that rounded shoulders forward head posture. That can lead to things like neck pain, shoulder pain, impingement, that sort of thing. So a simple stretch there is just a corner doorway stretch. So just putting an arm on either side of a door jamb and then gently leaning forward until you feel a stretch in those muscles can really kind of break up that, again, rounded shoulders forward head posture. And it's a good, again, you can kind of just mix that in throughout the day. I mean, take a couple minutes to stand up, perform that stretch, and then you can return to that position to, again, break up that position of from sitting for a long period of time. Number two, I also think, again, this is another muscle that gets chronically shortened. So looking at the hips and the hip flexors, again, being in a seated position, that muscle isn't allowed to move through its normal typical range. So simply getting down into a half kneeling position, so down on one knee with the other leg forward, and then gently lunging forward until you feel a stretch in the front of the hip. Again, that's going to elongate that muscle that tends to shorten as our knees and hips are in a 90-degree angle. So another easy one we can do, again, to kind of break up the workday. And a lot of times when this is chronically tight, it can lead to things like back pain, hip pain. And, as you let that go on over time, even things like osteoarthritis, just due to abnormal biomechanics or the way we move. And then last kind of one we'll hit real quickly here, work on our way down the extremity, is just a general calf stretch. Another easy one to do. It's not something where you have to get on the floor, anything along those lines. But as we age, we tend to lose ankle dorsiflexion. That's just the medical term for being able to pull your foot up towards your shin. And the reason I like to bring this one up as well is because this can have effects anything from foot and ankle problems, knee, hip, even back. So when we lose that, we tend to think of problems like plantar fasciitis, things of that nature. But actually, when we're limited in that motion, it can put more torque and stress on the knee joint, which can affect the hip. So it's really one of those things that can kind of affect the entire kinetic chain or the whole leg, so to speak, when we're limited in that motion. So just standing up, kind of leaning against the wall so you have something to push on, bringing one foot back behind, the other forward, and then just pushing your heel, that back heel, into the floor, feeling a stretch in those calf muscles. Again, it's not one you have to get down on the floor for. It's something simple. You can, use a wall in your office or wherever you are. Perform, a couple rounds of 30 seconds. That's usually a sweet spot. We want to look to get all the golden time frame, particularly when we get older, usually a little bit longer is better. The phrase I like to tell my patients is low load, long duration. So that doesn't mean, we're pushing as hard as we can. We don't want to experience pain with any of these stretches. We're really just going for a good pull, maybe slight discomfort at the max. And then again, that total of 60 seconds. So whether it's 2 rounds of 30 seconds or, you could break it down into 4 rounds of 15, whatever feels best for you. But again, all those are kind of, again, to break up the prolonged sitting, sedentary postures that we tend to see a lot of our folks in. And again, with these desk jobs that a lot of times people are in for years and years, with time, those can obviously lead to a great deal of issues with mobility, flexibility, and our joint health. So those are a couple simple stretches, and we can take 5 minutes throughout the day to do that can really, really go a long way in maintaining our joint health as we age.
Yeah, it's so vital that we take that time. I know some young people, young women under 30, and talking to them more often than not, I hear them complain about lower back pain. And they don't realize it comes from sitting a whole lot.
Absolutely.
And so, and just imagine now, as one gets older, they start getting past 50, going into 52, 53, 54, and they're also putting on the weight. What is that doing to their bodies, you see? So it's important to have that movement, at least do certain things. Now, let's just talk about flexibility in the core and why that's important. Could you help individuals to see that? What can be done?
Yeah, absolutely. So yeah, when we're talking about the core, and we'll kind of again relate it back to some of those negative postures that we're talking about. So yeah, with prolonged sitting, we'll talk about disc health a little bit here. So when we talk about intervertebral discs, those are essentially the small fluid-filled discs in between each one of our vertebrae. And again, as we age, we tend to lose water content again. So we're kind of bringing back the water, the hydration status.
So
But yes,
people are talking about, we're talking about the back and the spine. For those of you who do not understand disc and things like invertebrate, we're talking about the back, your spine that goes straight down. So he's helping us to appreciate again your flexibility and now your water intake. As far as that's concerned too. Sorry to interrupt. Kick it in.
absolutely. Yeah. So again, yeah, as we lose that water content, our discs again between each one of those bones on our back. Are more susceptible to things like slippage or herniation, prolapse, those sort of things. Medical terms for when the disc tends to push out the back and side. So not in a typical position we want it to be in. And as it does that, a lot of times it can put pressure on things like our nerve roots, which can create back pain, or things like sciatica, pain down the leg. So some things we can do to kind of mitigate that or keep the discs nice and happy in a position where we want them. So the first one we'll talk about is a prone press up. So laying on your stomach, pushing up through the hands and arching the low back, and is a real nice way to centralize that disc or move it back into a position of where we want it. So again, a real simple exercise. We can kind of do 10 reps at a time, just holding a few seconds for this one. This is more of a position as opposed to a duration per se.
Is that
So
a cobra pose? Do they call that a cobra pose or something?
yes, yeah. So yeah, in yoga, it's a cobra, and physical therapy, we call it a prone press up. But yeah, essentially, again, keeping your hips on the floor, arching up, pushing through your hands. Again, a real nice position to help move that disc back to a position of where we want it. So that's a really good one again to do to break up those long terms of sitting. A second one, again, this one will be done on your back. This is going to be more low back and hip, so a nice kind of way to get a 2-for-1 deal here. So a common muscle that is often talked about when we talk about back pain is the piriformis. It's actually an external rotator of the hip, so it functions to move the hip in a certain way, but a lot of times it's really highly implicated in back pain as well. So simply laying on your back, pulling your knee in toward your chest and then over towards your opposite shoulder is a real nice way to elongate or stretch out that muscle. Again, here, kind of like some of the first exercise we talked about, we want to try to go for that 60 total seconds. So whether it's 2 for 30 seconds or 4 for 15 seconds, and making sure we get both sides. So when we're talking about flexibility, we always want to talk about symmetry as well. We want to balance our bodies out, kind of emphasizing both sides. So those are two really, again, simple but effective exercises we can use for back health. Really any age, but again, particularly as we get older, we're more at risk for some of those things we talked about, with our discs wearing away, shrinking in size, being more prone to that slippage or herniation. And these are some simple exercises we can do to help prevent some of those negative diagnoses.
Very powerful indeed. It's clear that you have a passion for your work. You're very knowledgeable, and I understand that polo shirt has a symbol that means something to you. Can you tell us a little bit about that and how it's connected to your family?
Yeah, absolutely. So I've been really fortunate. I have three younger brothers, two of which are directly involved in the business. The other one helps out part-time as well. So really fortunate to have some cohesion there, being in business with people you trust. But yeah, ever since we were young, we've always been really, really close, share a lot of the same core values, passions, for helping others. Always been really emphasized fitness and enjoyed fitness, being active. So yeah, we've always had a goal of kind of doing something such as this. Really, the business has been in plans for the last number of years. It's really been a work in progress, and we're all really excited. It's finally come to fruition here. Recently, just opened our doors. So yeah, the kind of our motto is keeping people active as long as we can, allowing athletes to stay on the field, older adults to keep running or weightlifting or walking or whatever it is that they enjoy doing, skiing, from XYZ, really keeping them doing what they love, throughout, at a young age to ultimately the older age, and doing that together as a family. So I think blending all those things together, it really creates a great environment for our patients, for our clients, and we love what we do as well. So really, really fortunate to be able to do that. And it's the old saying: whenever you love what you do, you don't work a day in your life. And I'm fortunate enough to be able to say that. So yeah, really, really lucky as far as that goes.
So what's the name of the company? 4QP. What does that stand
Yeah, so it stands for four quarter performance. So yeah, we chose that, the four brothers, and then the four quarters as well. We always, a big emphasis for us is finishing. So whether it's finishing the workout or finishing, working towards a goal, it's a big kind of symbol for us, kind of intertwined to that name. So that's another big part of the business. So we really liked it in terms of, combining the whole family, in addition to working from start to finish, beginning of the journey to the end, and every part of that. So yeah, we were happy with the name. Really felt that it kind of fit what we were working towards.
Yeah, that's cool. Family is vital, and even just having that dynamic contributes to your overall health as well. So that's a beautiful thing, and the fact that you guys can work together that way. Well, Kevin, you came down here from Indiana, Pennsylvania. And we're glad to add another Yankee to the pot here, folks. You know, but I've got one more question that I ask all of my guests, and this kind of wraps things up, gives us your philosophy on life, your core values. So I will ask you this, Kevin Stapleton: what does it mean to you to crush your mountain?
And I think that's kind of a perfect segue from the last question as well. So I had a coach in college that always used to say, focus on the process, not the results. And I think that kind of goes really nicely hand in hand. nice analogy to crushing your mountain. So I think for me, it's and in this business, it's been a long journey. But I think setting small goals that kind of work up to whatever that ultimate goal is. So we're talking about climbing a mountain or crushing your mountain. I like to think of it as, okay, tomorrow we're gonna reach this altitude, or we're gonna get to this spot. Reach that goal. All of them working up towards that ultimate goal of reaching the peak. But I think, setting those small goals for yourselves, having those small victories along the way are crucial, because I think when you just have one ultimate goal that kind of seems almost unreachable, it's really easy to get down, depressed, thinking you're never going to achieve it, or you're not successful when in all actuality you are. So I think, again, setting those small goals so you can have some success while you're ultimately working towards that goal, whatever it is. I know for us, as I kind of alluded to, it's being able to help as many people as we possibly can, continue to do what they love. That gives us satisfaction. That obviously helps our patients, clients. So it's just, I think it's an atmosphere that everybody can benefit from. So yeah, I think for me, crushing your mountain is, again, focusing on that process, the climb, and then ultimately, with each small goal, you're going to reach that peak for whatever it is in life. And I think that's, ultimately what all of us are striving for.
Very cool. Excellent point. I'll tell you, it's so vital that we have specific goals, and everyone thinks in terms of getting to the end, and that's true. That's important. When we're talking about process, that is planning the work. So with us, we do the CR.U.S.H method, which is conceive and commit. So you have to conceive of what you're doing, but once you visualize it, encapsulate it in your mind, see the light at the end of the tunnel before you even start working at it. Then you commit to it with all your heart, because we know you're going to deal with adversities, even if it's feeling the creakiness in your joints, even if it's feeling the bit of the pain in your body. You know that if you keep going, you'll reach the end of your tunnel. You'll reach the end, and you'll find the goal that you want, the outcome that you want. So the idea, again, is to avail yourselves of individuals like Kevin Stapleton, 4-quarter performance, as well as his brothers. I don't know them personally, but I know Kevin personally. I can tell you he's a cool guy, very knowledgeable, as you can see, very patient, and he knows his stuff. He does the work, the high profession. And that's the type of individuals that we want to work with, and that's the type of individuals that work with us with my company. But most importantly, the type of person you want to be for yourself in your life. So as I tell everyone at the end of the show, thank you again, Kevin, for being here. Don't just climb your mountain, folks, crush through it. And by the way, you hear me call the show Crush Your Mountain. You understand that I own a company called C.R.U.S.H Transformative Coaching. As of the beginning of next year, 2024, we're going to be called officially Crush Your Mountain Coaching. And that's going to take into consideration so many different things. And it's going to be an all-service thing. You'll have individuals, affiliates, such as Kevin and others, that will help you to reach your health, wellness, as well as personal growth outcomes. So once again, don't just climb your mountain, crush through. See you next time. Thanks again, Kevin.
Thank you.